Hello and welcome. My name's Neil Chapman and we're here today to talk about a topic that affects millions of people around the world. That is high blood pressure or hypertension. Your blood pressure is a critical marker of your heart health, and understanding it can help improve the health of yourself and your loved ones. We've received a lot of great questions and I'm excited to dive in and give you some of the information you need. We know that most people with high blood pressure need at least 2 drugs to control their blood pressure. So if your blood pressure is not controlled with one medication, that's not at all unusual, and you probably need more medication. Even with very healthy lifestyles, you can still have high blood pressure, and as you get older, your blood pressure will go up, and therefore people tend to end up on higher doses and on more drugs as they get older. High blood pressure increases your risk of cardiovascular events. Blood pressure rises as you get older. So unfortunately, management of high blood pressure is a long-term issue and usually means lifelong, certainly lifestyle changes, but also usually treatment. It's not like an infection where you take antibiotics for a week and it gets better and you're cured and you can forget about it. With blood pressure, it's going to stay high unless you lower it with lifestyle and medications. Almost all of the medications that we use for high blood pressure have been around now for decades. They're safe and we have decades and decades of experience, and we know that people can take these for 40, 50 years with no adverse effects. On the contrary, what causes problems is not treating the high blood pressure. That's what causes the heart attacks, the strokes, the heart failure, the kidney failure, whereas taking blood pressure lowering medication actually reduces those. Blood pressure varies naturally, hour by hour, minute by minute, heartbeat by heartbeat. So your blood pressure will vary, and it certainly varies across the day as well as longer term. Even if you take your tablets, that will be the case. Most of the blood pressure tablets that we take are long acting. Most of them you only need to take once a day. So if you are taking them once a day on a regular basis and you're not forgetting to take them, that will control your blood pressure as well as that tablet can. Obviously, if you don't take your tablets, then you may get increased fluctuations in blood pressure as well. Any tablet for any medical condition can have side effects, and if you read the product information leaflet, you will certainly see a lot of side effects listed. But most people do not suffer those side effects, and most of these drugs are very well tolerated by most people. But there are significant side effects, and that's why, for example, with some blood pressure lowering medications, you need to have blood tests when you start them or if you change the dose. But generally, they're very well tolerated. The benefits of the treatment outweigh any risks. For blood pressure lowering drugs, there is no evidence that you become immune or tolerant or you stop responding to those drugs. Now, that's not the case for all drugs, including some other heart tablets, which you do stop responding to them. For blood pressure lowering drugs, there's absolutely no evidence that happens. And if your blood pressure does start to go up when you're on a tablet, it's usually not because the tablet isn't working, but because you're getting older or because you've gained weight or eating more salt or some other reason for your blood pressure rising. If you don't take prescribed blood pressure medication, then your blood pressure will go up undoubtedly, and that increases your risk of the cardiovascular consequences of having high blood pressure. There are plenty of reasons why people don't remember to or don't take their blood pressure tablets. It might be because they forget, it might be because they're having side effects, it might be because they don't want to take tablets. But I think it's important to think about that. If you're forgetting to take your tablets, can you build it into your daily routine? If you're getting side effects from your tablets, please talk to your doctor about that, because there are plenty of other drug classes that we can treat you with that you probably won't get side effects from. And if you don't want to take tablets, then please also discuss that with your doctor, because it's important that you understand that if you don't take your blood pressure tablets, your blood pressure will be high, and it does lead to increased health outcomes such as heart attack or a stroke that most of us want to avoid. Because high blood pressure doesn't cause any symptoms, unless you measure your blood pressure, you won't know what your blood pressure is. You won't know if you're at increased risk. So it's important. Get your blood pressure checked whenever you can, perhaps whenever you see your GP or at any time the opportunity arises. Remember, it's important to know your blood pressure, know your numbers.